Welcome to our In the Blue broadcast today. Great to be back with you after a busy week last week at the AADGP. And for those of you who joined us at the AADGP, it was an amazing event. In fact, a follow-up from that event, we're excited for our guest today. And before I introduce him, I just want you guys to hear what we're talking about. As you know, BlueIQ is all about bringing you guys tools of scale. And one of those key things is obviously driving production. And we all get stuck in that dilemma of, do we hire more? Do we open more hours? How do we really engage the best productivity out of our team without burning them out, obviously? And I'm happy to announce that our guest today is an expert in this and really understanding things and scheduling and leading the providers to optimize their productivity and driving up that productivity per hour per provider, which is what BlueIQ is all about. So I'm going to introduce today our special guest, which is Dr. Mark Mosier. And his background, he's been in private dentistry. He's been on 2 faculties of dental schools. He has been a board member with the AADGP. He's been in consulting. He's consulted several DSOs. He's been in investment banking, so he understands the valuation and all of these different things that people these investors are looking for in the evaluation of a group, and then has built a group that is just amazing. So Mark, thank you for joining us today. You are an incredible host at the AADGP last week, and we just couldn't be more happy to have you on the show. And of course, my co-host, Joseph Stith, here is as well.
Well, guys, thank you so much for having me, and thanks for all that flattery. I'm gonna have trouble walking out. I'm gonna have trouble walking out the door after that. My head's a little swollen, but I appreciate that.
I didn't even go into your being a part of Christian service groups, and I mean, good grief, I could go on and on.
Let's not make this about me. Let's jump right into this. I am excited. I'm like a kid at Christmas waiting to open presents. This is an area I'm passionate about. I mean, I absolutely love this area. Yeah. I love teaching people to lead, and I love helping people be successful and celebrating their successes. You know, when I do consult with a group or an individual practice even, you know, when I see money laying all over the floor, and it's just not money, you know, success isn't always defined in dollars. It can be more flexibility, greater self-esteem, family values, more time with family, contentment. I see contentment is a big word in success, and that's different things, different people. Maybe it's all the above or more. So I practiced for 25 years, 3rd generation. I had big shoes to fill. You know, my father and grandfather were very involved in practice management, and I won't go into detail about that, but they were very, very involved. My grandfather was a founding father in practice management organizations, and so I'll never achieve the level that they achieved, but I will try. I've been trying. I'm always thinking of 3 things. As a dentist, as a consultant, I'm always thinking of 3 things. I think about quality. When we never go backwards in quality, we maintain it at minimal, but you know that's why we practice dentistry. Things are always changing, so if we can improve it, great. I'm thinking about efficiency because you know efficiency means a lot of things, a lot of people, but efficiency ties into our 3rd thing I focus on, which is easy. I always say maybe I'm a little inherently lazy. I don't know, but I like easy. But when you can hit on all 3 in a practice, then you're moving ahead. So I'm always thinking about those 3 things. You know, years ago I took organic chemistry, and I'm sure you did too, and you think about the limiting reagent to a reaction. When that limiting reagent is gone, the reaction stops. So always ask yourself, what is the limiting reagent? Identify that. Always think. And really, in most situations in a dental practice, the most valuable asset in the practice is the doctor's time. So around that, you make everything move and bend and direct towards supporting the doctor's time. You know, I always say a well-managed office is an office that is where the limiting factor is the doctor's time. So the doctor should be doing what the state dental board says that they can do and only they can do And then beyond that, you look at training, certification, skills, technology, anything that will further support the doctor's time. Now, in addition to that, the doctor needs to establish and maintain a high level of quality relationship with their team and their patients. So it's just not clinical. The relationship is very critical to successful practice. So if you've got the relationships established with the team and the patients, and every move you make is a move the state dental board says you have to make, you're getting there. You will never be perfect, but you'll be closer and closer. So with that said, there's some things that I commonly see. I mean, there are 100 things, more than that actually, that will impact this, but there are some things that I see common. That's what I like to talk about today on unlimited time. And the first one I want to dive into, and these are things I see almost all the time, and that has to do with engineering the schedule. And, it is truly engineering, where you're scheduling doctor time or hygiene time. We can talk about leveraging, after you get the dentist correctly leveraged, you talk about the hygienist, because they're really the second most valuable asset in a practice. So we got to break away from the dental school mentality. Dental school mentality, they scheduled chairs. One chair, and then they schedule one procedure, one chair. We'll get back to that in a minute. But scheduling chairs. I walk in these offices, they have all the chairs in their schedule. This chair, this chair, this chair. Well, yeah, you got to be aware of that you have enough chairs for patients, but all your chairs should be the same, your treatment chairs. You should never have a favorite chair. If you do, well, make them all your favorite. Do what it takes. Make them all the same. But you need to schedule the doctor time. Where does the doctor need to be? And the front office needs to know that, or whoever schedules you needs to know that. That is a skill in itself. I've seen some of these offices have been where the front office has been there for 20 years, and he or she says, well, I just know. And they probably do. They're probably pretty close. Now, there's different ways to do this. I hear about the rock, pebble, sand philosophy, where you get the big cases, small cases, itty-bitty cases, or the templating. Most software is set up for EagleSoft, Dentrix, for templating or scheduling emergency times. But there's a better way yet where you identify where the doctor time is. And briefly, what I encourage these young docs to do, just out of school maybe, they print a blank schedule and they write the 10, 12 most common procedures on that schedule. And they'll put, I'll give you an example, crown prep. Let's say that after practicing for 10 years, you're pretty good at your crown, and we don't have a CEREC yet. Crown prep time is 60 minutes, and we're booking in 10-minute increments. Now, Dr. Ron Goldstein in Atlanta, Georgia, he's much better than I'd ever be. He was scheduled in 2-minute increments. That's amazing.
Wow.
Amazing. My machine is pretty well oiled, but not that good, but 10, 15 is very counterproductive. So if you get to 10, that's good. And some things you don't schedule time for. I never schedule time for hygiene checks unless it's the initial exam. I may not schedule times to remove a suture, a minute here, or even anesthetize. But hopefully I had a hygienist certified in anesthesia and is okay in my state to do that. Do a anesthesia for you. That's the example of leveraging. So the crown example, 60 minutes, that's 6 10-minute blocks. And the software, all dental softwares do this. They can identify by colors what procedure it is, where the patient is in the chair, how much chair time, and then by on the left-hand margin where the doctor is going to be. It might be an X, could be a color, it could be a slash, whatever you choose. They're all customizable. So the first 10 minutes, I don't give any doctor time for because that's anesthesia time, prep time, PR time with the assistant, records, but mainly they're getting numb. The second and third set of 10 minutes is doctor time. That's crown prep time, retraction time. Again, we're not CEREC. We may be using cord, maybe using cordless techniques. But, it's another topic about 5-minute crown preps as set forth by famous Omar Reed. But go back and Google that, 1980. Great video required for all my docs. It's hazardous efficiency. But, 20 minutes is really more than enough if you're experienced. If you're just out of school, maybe 30, 40, or maybe longer. But once you leave for the retraction time, there's 10 minutes where the doctor's not there. So far we have the first 10 minutes, non-doctor. The second and third 10 minutes, doctor. The fourth 10 minutes, non-doctor. Now, the fifth set of 10 minutes in a 60-minute block is doctor time. That's where they're taking the impression, and that's really it. And the last set of 10 minutes is a temporary. You leverage that to the assistant and clean the room and home care instructions are done. So that tells you do that kind of situation for each common procedure. Now, there are going to be exceptions to that, but we're talking common procedures. We target the 80% rule. That's a big jump in the right direction. Let me tell you a little story briefly. Before I was taught this strategy by Linda Miles 20 years ago, I used to measure how tired I was at the end of the day when I look at by how productive I was. And it was proportionate. I look at the day sheet, I'd audit, make sure things get billed. If you're not auditing your day sheet, you need to start because the things get paid 100% are missed. X-rays, exams, 100% preventive get missed. So audit that. It'll make a huge difference in your income. So I'd audit that, and how tired I was always proportionate to how productive I was. As I learned to schedule efficiently and leverage some of these other things we're going to talk about, that wasn't true anymore. I would have lunch hours. I'd walk out there at 5 o'clock. I look at the day sheet. I go, wow, I was that productive. True statement. My income and production tripled after I thought I had maxed out by doing these simple things. So again, entering the schedule correctly is very, very important. Schedule doctor time, not chairs.
Love it. Love it.
Yeah, that's
So
incredible.
just for our audience, go ahead, Joseph.
It's unique to dentistry, isn't it, Mark? I mean, other doctors can schedule based on time for the procedure or time for the chair, but in dentistry, it really is a creative process with engineering down to the minute.
Well, you know, as a well-oiled machine, I used to run behind, run ahead, have 40 minutes open schedule, and it didn't look like that looking at the schedule. But, you know, there are a lot different ways to schedule. There's the typical MD's way where you have 8 o'clock appointments, 1 o'clock appointments, that throw everybody in there, and they just kind of work around the doctor's time. It works great for the doctor, disrespectful to patients because they got to wait 2 or 3 hours to see the doctor. We've all been there. The other way is you just kind of shoot from the hip and hope 5 o'clock still gets there. You know, and then there's those other ones I mentioned. But this gives your schedulers knowledge of where to put your patients, your treatment as, because it shows the time available. Now, here's what's cool. Your software will do this. I haven't seen one that does it. You can say, okay, I need, I'm going to submit this crown. I need 10-minute doctor time over 30 minutes of chair time. We call that 1/3 in 10-minute units. And I don't want it within the next 2 weeks because I want lab time, and the patient can only come in on Tuesdays from 2 o'clock to 4 o'clock in the afternoon. You can put that information. It's going to go the first available time with those parameters. But it gives them guidance of where to squeeze patients in. And as the day goes on, it seems easy because you're not running ahead, you're not running behind, you're not stressed, staff's not stressed, and you're more productive.
Love it. Hey, Mark, before we go into this next point, just a big shout out to Lacey from Practice Dynamics. Joseph, she says, hi. Thanks for joining us, Lacey.
Okay. Great.
So,
appreciate it.
Mark, that
good hearing from you.
I just want to reiterate one phrase for our audience. When Mark said he tripled his production once he mastered the schedule, and so that's just key number one. Production with key number one. We're now going on to key number two, which is going to continue to help drive that production.
That was after I had peaked out. For 3 years in a row, I had plateaued.
Yeah.
This is it.
Wow. Amazing.
And it got easier, and I was more rested, and I was less stressed. It's a big deal.
Incredible. Yeah.
So.
Okay, so number two.
All right. Completing newly diagnosed treatment the same day. You know, the common term that has hit the industry is called fish bowling. And that's basically pulling treatment off of the hygiene schedule. Now, this is a longer topic that I'm not going to go into detail, but basically you're working the treatment in while the patient's still there. Now, it's all about scripts. A script is something that's true, repeatable, and personalized. And scripts are usually used in response to statements or questions that are somewhat difficult, or they can be used to encourage people to do something. In this situation, I find here's a recare patient, comes in every 6 months. They're not going to have an $8,000 treatment plan from being healthy 6 months ago, but they may need a buckle pick composite. They may need something small. And so I no matter what, I'm always doing patients favors in their mind. If I'm going to get them back in for treatment, I say, I'm always working them in. Mrs. Jones, your schedule is busy, but I feel really strongly about this. Give them a reason to come back in. Give them a sense of urgency. I'm concerned about this getting worse, so we're going to try to work you in as soon as we can. Even if our schedule's wide open, I'm still using that term. We're going to try to work you in as soon as we can for your benefit. Yeah. In this situation,
for new dentists, for new docs, new dentists, take that to heart. From day one that you open your practice,
absolutely.
Create that urgency.
Absolutely.
Right from the beginning.
Absolutely. It makes you look busy. When your success breeds busyness. That was another little miles thing. My grandfather, when he first started practicing dentistry in 1922, with my grandmother as his front office receptionist, sweep the floor person, she only had 2 patients in one day. We scheduled them at the same time, so they looked busy.
Yes.
Busyness breeds busyness. So you always work a minute. So Mrs. Jones, you're a busy person. I tell you what, we're gonna try to do you a favor here. If you don't mind waiting, we're gonna work in and just get this done today, so you don't have to come back. Would you like that? Of course they like that. So you never tell them you're gonna do it without the blessing of your financial consultant. Let's see what's going on with your insurance, etc. So the financial consultant goes in just before you anesthetize, before you commit yourself, says your copay is gonna be this or fee, whatever it is, and they give you the thumbs up, and the hygienist is already told by the doctor if you have a thumbs up anesthetize, or if you don't have a hygienist to deal with anesthesia, you go back in and do it. If you need anesthesia, maybe you have biolays or air abrasion, and maybe you have a caries detection system, so you know how deep that cavity is. You don't need to anesthetize. You can be real efficient with some of these other technologies. Again, technology leveraging the doctor's time. Yeah, I did a lot of anesthesia procedures, early air abrasion, later on biolays, water, air type systems where you didn't need anesthesia, and the patient didn't have pain as quick. But because I had caries detection systems like the early Diagnodents, or maybe now it's Canary, which is outstanding, some of the later systems, Spectra, Sopros, a lot of really good ones, where you knew what you're getting into before you get into them. You didn't go in there, whoa, there's a room there. So you knew what you get into. You can do these things quick and efficient. So by doing that, I mean, you think that's not significant. Do the math on this. Let's say I do $175 procedure, which is not much, a day, just one a day, 4 days a week, 50 weeks a year. That really adds up.
Oh,
and you can
really
work them
adds up.
in. You can find a way. You have the chairs, you have the assistants, and they're well trained because you train them. It all starts in the team meeting. They know what to do. It takes 5 minutes of your time. Done. But
Hey,
it's
Joseph,
big
you've
deal.
been in the industry for 30 years. What has been your experience in just consulting these dentists that aren't doing what Mark is sharing with us? And what is the difference in production when you see them begin to do exactly what Mark's sharing?
Mark's right, and I think it all comes back to a well-coordinated morning huddle where you're looking at where would that be the best fit. And sometimes we don't look at that, but the staff knows. They know if they know the doctor's schedule and they know what may be coming out of hygiene, so much of that can be coordinated in advance because it's not like it's all guesswork. We have a lot of it that's in the schedule already that we're just not looking for with the right tools, the right technology, like Mark said.
That's especially true. Identifying times morning huddle, particularly when you're talking about larger procedures like such as crowns. But for these small ones, you notice part of my script was, if we're going to get it done, you will have to wait. That's important. You will have to wait, but we'll get it done. By telling that, and that's a verbiage I use with emergency patients too, which is another topic I love to talk about sometime. Very passionate about non-scheduled emergencies for a win-win. In ours, make it work for us and our scheduling. It's a great, valuable topic. I've had many people, many doctors say that was one of the best things they ever did, taking the pressure off, but yet keeping patients happy and out of pain and seeing them. By telling the patient that you're working in the schedule, okay, you will have to wait, work in, but we'll make it happen today. I used to put magazines in their hands, and now they all have their electric entertainment gizmos. They're usually pretty good with that.
Yeah.
But you have to tell them, you will have to wait, we will work in. So it's on our terms.
Mark, number 3, Mark, is bundling treatment. What do you suggest?
Wow, that's a big one.
Bundling.
I was consulting just yesterday with the Medicaid group, and my experience with Medicaid kind of, in order to be very productive with Medicaid, especially if you're not doing children, because children pays more. Well, yeah, throwing kids in the hospital and doing a lot of things at once, that's bundling. Bundling is doing a lot of things at once. That can make you productive. But basically, you have to do a lot of things at once to be productive in Medicaid. So let's take that back to all your patients. In dental school, they teach one procedure, one appointment. How inefficient is that? So, Joseph, you come in as my patient, new patient exam, and you need several composites, maybe a couple of crowns, maybe endo, maybe perio, maybe not, but you need several things. Well, sometimes you have to do one procedure and let it sit. Maybe we have to do a bone graft before we throw an implant into it. Some things require waiting.
Right.
Most
Right.
don't. Patients don't know that how you would do it, normally do it, used to do it, how you do it in dental school. So I'm a huge fan of bundling. Getting that patient back in for fishbowling saves overhead too. They're already there. Maybe you use the same chair to treat them in. But if we have those 8 procedures on you, Joseph, and I wouldn't say, well, we could do it this way, do this, or could do it this way. I don't ask questions and I want to get answers. I only give choices that I want. So I would say, well, the appointment's going to be a little long, Joseph. You may be here 3.5 hours. So bring a good book, bring your electronic phone, whatever, and we'll give you breaks. Don't worry. Once in a rare while, somebody say, wow, you can work that long on one patient? I tell the patient, I'm going to work on patients 8 hours a day. Whether it's one patient, 40 patients, it's all the same to me. That makes sense to them. That makes sense. So to sit down and do 3 hours of treatment on one patient, I'm telling you, it's productive.
It is
have
very
them come
productive.
Back for 8 different appointments, overhead, setup, anesthesia. I mean, it's a lot of overhead and it's a lot of time. You can cut your time down by about 80% by bundling. It's a big deal in overhead. Learning to use long-lasting anesthesia if you have to. Learning how to give breaks. Learning how to use bite rest, bite blocks. We call them bite rests. More positive. Bite blocks for them to rest on. Learn how to recognize if they need a break. Talk to them in front. Raise your hand. We back off. And tell them, I'll be checking hygiene. Tell them, I'm going to step out for a few minutes. Good time for bathroom break. Step away. Let them know before you schedule that it's not going to be a marathon to them. It's going to be enjoyable and easy.
Mark, have you found over time that as you become a more proficient and experienced dentist, that you found the means of keeping financial arrangements out of the way so that you could do larger blocks? I mean, we could talk an entire session on just that.
One of my popular articles was called "Banking Anyone." I could talk about this. This is a topic of its own. Briefly,
it is
80% of lawsuits and board complaints are from bad debt, not bad dentistry. So I didn't go to dental school to be a banker. You lose patients from bad debt. I had a sign in the office that said that patient down the street that's going to that wonderful dentist that makes them pay up front instead of that jerk they owe money to. You'll lose them. We work so hard to get patients. I would rather choose my charities, have them choose me. I'd rather not do the treatment than have bad debt and lose a patient. It's a big deal having financial arrangements set up before you schedule.
And bundling is critical to that. I mean, if we're going to bundle treatment, you have to bundle the financial arrangement so that patients aren't saying, well, I can only afford 1 crown this year, and that's all we do. You've got to get beyond that, right?
There's a reason that, it's usually around insurance. There's a reason that insurance companies have big, giant, fancy, expensive buildings. It's their job to keep their money, and I give it away. And if a patient chooses to let their treatment plan pivot around what the insurance won't pay, they will lose every time. It's not insurance. Gordon Christian said it's a benefit. It's a dribble. It's like a discount. It's like a discount coupon. And that's great. I rejoice in that. That's great. That's better than a lot of my patients that have no insurance. I'm glad you have that. But do not. I mean, the average maximum insurance today is still $1,500. That's what it was in 1964.
Isn't that incredible?
That's average.
It's ridiculous.
So it's a discount. It's a service. That's all it is.
And last but not least, Mark, you're into your 4th key.
Yes. I kind of blended into this on the first key when I was talking about engineering the schedule, or your time. I said a well-managed practice is when the dentist or the hygienist is doing what only they can do according to the state dental board. In addition to that, to being able to establish and maintain a high-level relationship with their patients and their team. That's very critical. So this gets to leveraging your skills. So I already mentioned a couple of technologies. Leveraging skills, an example, Diagnodents, that's a modern-day dental explorer, or Sopra or Spectra, caries detections, or caries detection systems. There's about 12 of them. I was blessed to go into the University of Texas where they did a double-blind study on this and work with the researcher. But this is a great way. That leverages your time, takes the guesswork out. I mentioned some of the systems, BioLace, for example, and some of the herb agent systems, some of the lasers you can use to make you more efficient. There's so many ways to be more efficient. So technology, I mean, it's more efficient to show a video to a patient, and risk management. There are ways that that video automatically gets put in the chart. Everything in that video becomes part of your charting, informed consent, and that lowers risk. But the point here is it's more efficient to show them the video than to explain. Early on, I was using pencil and paper. Then I graduated to the dry erase boards with all the colored markers. Then photographs. It's their thing. I still love my camera. Don't take my camera. I love how to co-diagnose, getting patients to own their problem when they see you as a team member. But it gets to videos. Videos are the great example of leveraging skills as well as photography. So also leveraging using people. That's the number one thing people, dentists, overlook. Get your assistants, make it required to work there where every assistant is expanded function certified according to their state dental board. They need to be as maximum possible. If you do have mid-level providers in your state, use them. I don't see the downside. Use your hygienist. You know, I used to think that every hygienist needs to be assistant. Well, I backed off of that a little bit. It depends on the chemistry of the office and the personality of the assistant. Assistant hygiene is where, think about it. Let me back up. I participated in a study at UMKC School of Dentistry where we followed a hygienist around with a stopwatch. There's several of us. And every time the hygienist had a scaler or an ultrasonic or a sonic and touched the tooth, actually did what only a hygienist can do and nobody else can do, we started the watch. The average time for the average adult on recare, this is not perio maintenance, not the new patient, average was 12 and a half minutes for an adult probe. They're scheduling an hour, 40 minutes, 12 and a half minutes. It's average. Some are faster, some are less. So the rest of the time is gab time. So let's look at what can be leveraged off the hygienist. Well, let's see. X-rays. In most states, somebody else can do that, like an assistant who's certified in radiology. Some states you don't have to be certified in radiology. Polishing teeth. Some patients need to be polished first to get rid of the plaque. Efficiency. Most after. Most states allow the trained, certified, registered assistant to do that. Feeding a patient, dismissing a patient, sharpening instruments, sterilizing the rooms, doing the record input, doing the home care, watching the videos, identifying the patient's personal passion, talking to them. There's all kinds of things to do. So it goes beyond just scaling. You know, I think if you do leverage hygienists, I see where two hygienists can share one trained assistant. That works pretty well. They're bouncing back and forth. All three of them are busy. And I had a really well-managed, expanded function assisted hygienist who wanted to do 3 adults an hour because she quoted that study. She goes, 20 minutes, I need 12 minutes. Well, you need to have that relationship. Maybe you need to talk more to them about home care, and they want to hear from you, not the assistant. Maybe you need to go to the bathroom. Maybe, you know, take a call, whatever. So really, I think 30 minutes is about as tight as I really want to take it, 2 adults an hour with the assistant hygienist. So leveraging the hygienist time is very important. The doctor, so much waste of time. Same situation. Walk around asking yourself all the time, am I the limiting factor as a dentist? Am I the limiting factor? Could somebody else do what I'm doing now with the right time, training, certification, licensure? Could somebody else possibly do this? We'll then start going that direction. Then after that, education. I mentioned technology, education, tools. Do I need to learn more about doing guided bone regeneration or implants or this faster impression technique using imaging instead of polyvinyl. Do I need to learn more about this to make me faster in the end? So there's a lot of education can help you leverage the doctor time. But it all starts with educating and communicating. Team meetings are essential in learning. You know, team meetings where you grow from. It's not about putting out problems, where you grow from with your team. So identifying and leveraging your skills, your time to other people, other things, being technology, very, very important. Very important.
Love it. And we've taken Mark's genius, and he has been an amazing contributor to our blog. So up on the screen now, I've got some of his most please go to getblueiq.com/blog. That's getblueiq.com/blog, and check out Mark's blogs, because here you have a unbelievable consultant. Both he and Joseph have just been incredible assets in the dental industry, and here they're giving away some of their most incredible stuff for free. And you can use these blogs and these videos in your team meetings, engage your team, have these discussions, turn some of this over to your team lead, and have them be engaged in that question of what's our limiting factor, as Mark shared with us, going back to our organic chemistry days. What is the limiting reagent, and how do we maximize those skill sets to drive production within our practices? Guys, any closing thoughts before we sign off? We've gone a little bit over today, but I think it was well worth it. I think our audience will love the content.
Well, you mentioned my generosity in giving away. You know, I think of my grandfather who invented some things and could have had patents on it, made a lot of money. My best payment, return on investment of my time is rejoicing in somebody else's success. I love celebrating success. And if it's a result of something I've helped them with, shared them with, that's fantastic. You know, if I can help anybody at all, for free or otherwise, I love helping other people. And I love this opportunity you've given me to do this online and maybe share some of these tips. You know,
Thank you, Mark.
Years ago, short story, I heard a lecture. I'd been practicing for 2 years, and as a dentist, I just retired. Gave a lecture called 30 Things I Know Now I Wish I Would Have Known Then. I always wanted to give that lecture when I got enough gray hair. Well, gray hair came, and I gave it, and I couldn't get it under 40. I could not give it under 40 things that are like my 40 best tips that I wish I knew those then that I know now. But my point is, these things we talked about today, if I was to prioritize, these areas we talked about today are right near the top of those 40.
These
very,
are the
very
top
important.
4. They are.
Nice.
Thank you, Mark.
Nice. Mark, thank you for joining us today. Joseph, thanks for being on the show. Remember, you can catch us here every Friday. We are here 9 Pacific, 12 Eastern. We are all about tools for scale. BlueIQ is here to help you guys become successful, grow your practices, and become the best practitioners you can be. Thanks for joining us in the Blue.
Thank you, gentlemen.